it's not just let's do synoptic reporting because we have to. It's let's do it because it's actually making our lives better, helping us make a better decision, helping us collect data for our own benefit, but also downstream, actually automate some processes into oncology and other areas. And also, I guess I should bring up too, though, outside of cancer, we talk a lot about cancer care with this, but a lot of pathologists are saying, but we want to do this, for other types of cases too.
Yeah.
For liver disease or other, skin, benign stuff. And, we've always done a fair amount of customization outside of the cancer, box, but I think there's a lot more of that coming. So we're seeing people voluntarily synoptic reporting outside of the requirements.
Yeah, and I think this plays into a bigger, because now with AI, the leverage is everywhere, and even though it's a little bit more permissive, the error combines, the error compounds. And it's not like, okay, you can still extract stuff out of garbage kind of data, a lot more than before, but if you want to take it to the next level on in different modalities, you mentioned the sequencing reports, surgical reports, pathology obviously, and then all the way up to information that gets to patients. Like a patient has trouble understanding a pathology report, they probably are going to paste it into ChatGPT and ask what that is. Most of the time they will get an answer, but why do they need to do it? Why? That is the information about their health. They should not have to decipher it.
Right.
So I think this whole, I don't know, I don't want to call it data hygiene, but it is kind of like data hygiene to have good structured data at every level. And another thing I wanted to tie it into is the multi-model diagnostics, where you have data coming from different sources. So to have data that is good is gonna prevent us from clouding the material you're working with. And AI is fantastic, but it has its limitations as well. Anybody who has worked even with the commercial version knows that you have to kind of police it, and you have to police it less if you have a template, if you have a structure, if you can send it with this, dictating, give me this and that template, right? So I think the combination of what you guys are doing with the new technology is gonna improve patient care and improve the life of healthcare providers.
That's the goal, and it's definitely not either or. It's how can we augment what we're already doing with all this new technology, and vice versa. You know what I mean? It's great to show off just how much you can do on free text with this stuff, but what can it actually do when it's given really good data is even better, right? And also that's why we're working in concert, with a lot of the companies here, right? Because we all have different areas of expertise, but together, stitching these things together, stitching the workflows together, but also the data and the images and everything else, it's very powerful. So it's important we all kind of work together to create an ecosystem that benefits the pathologists, or and the patients really in the end, but benefits the practice of pathology in a way that just one company can't do on their own, or one technology can't do on its own.